Hi everybody. Today we're going to talk about long haul COVID, the symptoms and the support. My name is Dina Seniza. I'm a breathing coach and Buteyko practitioner and founder of the Breathe Clinic. I have long been wanting to talk about this. In this whole discussion on COVID and management of the disease and after, there is an overlooked factor. It's not the only factor, but it's one of the factors that can help contribute to a patient's wellness and recovery. And this is breathing. And it's surprising because COVID is mainly a respiratory disease. Of course, it's concerning all the different organ systems. We see that it's a multi-organ disease, but the main symptoms are respiratory, and you would think that looking at breathing health, breathing efficiency would be one of the things that is a main factor, something that they would put into the picture. Now, we are going to concentrate on the long haul COVID cases, okay? So what is long haul COVID? It is when the patients have recovered. They're not in hospital anymore, but they still have the symptoms, some mild symptoms, and they can range from shortness of breath, easily short of breath, whether at rest or during movement. There's a lingering cough. There's fatigue, chest or joint pain, palpitations, headache, brain fog, sleep disorders, anxiety, depression, and many other symptoms, many more symptoms. But these symptoms that I've listed, these are most of when I've looked at all the literature about what are the symptoms for long-term COVID. These were the ones that were always coming up, okay? Now the surprising, well, not really surprising, but something to note is the ones that I've just mentioned, these are also symptoms of chronic hyperventilation syndrome. Okay, so why is that? Why is that happening? So, when the body is under stress, and it can be physical, and physical can mean an accident, an illness, and such as COVID, an intense, even acute illness, when you're in a mental or emotional stress, or maybe a chemical stress, exposure to chemicals or pollutants, your body works hard at managing it. So when your body's working hard, you elevate the breathing. Breathing goes up because it's working hard. You need more oxygen, you need glucose to be delivered to the parts of your body. It is natural, it's your body's coping mechanism. Now, when the stress is either quite intense or is prolonged, then this coping, this breathing, the way you're coping can become a habit or can get stuck. So it becomes your normal breathing. So you're now breathing slightly faster. So this is the stressed kind of breathing. You're breathing slightly faster, slightly bigger. You have a tendency to mouth breathe. It's quite irregular. There is more, it can be interrupted by coughing, yawning, sighing, breath holds, throat clearing, and things like that. So that is a stressed kind of breathing. Now, when the stressor is gone, so when you're actually, when you don't have COVID anymore, the illness has gone away, but you have lingering symptoms. You think, maybe the breathing has not gone down to baseline again. Maybe it's stuck. And this person is breathing, is hyperventilating with a chronic kind of hyperventilation. And that's why these symptoms are coming. I'm not saying that's the only reason. But see, I always liken it to a room with a lot of clutter. So if you have a big family and lots of children and you have a family room, tendencies you'll have a lot of clutter there. Now, the best way to do things is to take out all the things in the room that don't belong there. And then it's more manageable. Now you can organize the room because whatever is in it, it belongs there. The same with the way we treat disease. If we take out all the symptoms, we address the hyperventilation. If we address the hyperventilation and are able to take out the symptoms that are hyperventilation related, then we are left with fewer symptoms, which will now help us focus the management towards what really needs to be done. Because we've already taken out the simpler one, which is let's fix their breathing, help them to breathe better and efficiently, and then some of these symptoms will go away, and then we'll just have to handle the few that are remaining. Okay, so now I want to clarify hyperventilation, because some people misunderstand what hyperventilation is. When we hear hyperventilation, a lot of people think the panic attack kind of hyperventilation. Yes, that is hyperventilation, but that is acute hyperventilation attack. That is an acute hyperventilation attack. There is a kind of hyperventilation which is chronic. So this is the chronic hyperventilation. That is something that most people don't pick up because it's not very noticeable unless you have the clinical eye or you're trained to see it. Okay, so I would see and I would pick up who among people around me would be hyperventilating with the chronic kind of hyperventilation that's not very easily seen. So I'd like to go through the symptoms and sort of explain quickly. We will not go in depth, but why is it? So fatigue. When you're breathing too much, when you have this kind, breathing entails two things. One is taking in the oxygen to go into the bloodstream. The second is you need to be able to deliver the oxygen that's in your bloodstream into the cells. We are all very good at inhaling the oxygen. So most of us will have enough oxygen in the blood, unless you've got some lung disease. But even then, only in very far advanced diseases, right? That you don't get to get enough of the oxygen. So you'll have the oxygen in you. Then the next thing is you'll need to deliver it to the cells. That's where a lot of people find it, there's where a lot of people don't get it right. Well, it's not our fault. It's just the physiology. We're not able to deliver it well because when we hyperventilate, we let off too much CO2, carbon dioxide. Now, we do need some CO2 in the blood because CO2 is needed in order to release oxygen that is bound to hemoglobin. Hemoglobin is the postie that brings the oxygen around into to the rest of your body. Because it's bound, you need to cut. I'm translating and speaking in layman's terms so that it's easier to understand. You need to cut the oxygen from the hemoglobin, and you need CO2 to do that. Now, if you don't have enough CO2, which is people who hyperventilate are hypocapnic or lack CO2, so you don't have enough scissors to cut away, to break the bond and be able to deliver the oxygen. That's why we're not delivering oxygen efficiently. Okay, so when that happens, then fatigue happens. One is you're breathing too much, so that in itself physically you're doing more work than your body needs to for breathing. That is tiring. Secondly, you're not delivering enough oxygen to your cells, and therefore you're not able to produce enough energy. Your cells need glucose and oxygen in order to produce energy. Okay, so if you're not delivering oxygen very well, then you won't have enough energy. So that's one. Shortness of breath and cough is the same thing. It's the more you breathe and hyperventilate, the cough reflex is triggered, and so you're coughing more. And the shortness of breath, again, is because you're not delivering the oxygen very well. So the cells and the tissues are actually not getting the oxygen they need, and that's why you are short of breath. It's the inefficient delivery of oxygen. Now, the same thing happens with the brain fog and the headaches. because when you're breathing, when you're hyperventilating, you're not delivering blood to your body organs, including your brain. The blood vessels, when you're hyperventilating, they constrict because CO2 helps relax smooth muscles. So smooth muscles are around your blood vessels, and therefore when they contract and constrict, then blood flow is restricted to the parts of your body, including your brain. So if there's very little blood flow to the brain, there's very little oxygen delivery, so that brain will be lacking in oxygen, and that will not be able to function. And therefore the brain fog and the headache. And at the same time, that brain will be, more under stress. So the anxiety that comes with it, because the stress on the brain, anxiety, depression. When your system thinks that you're in danger, which is when the brain is like that, not much oxygen and there's anxiety and all that, your nervous system is hyper alert and hyper vigilant, then your brain will not let you sleep, and thus the sleep disorders, because your body thinks you're in danger, and therefore won't let you sleep in case you need to run away from the danger in the middle of the night. Okay, so that's why your sleep is quite shallow and you don't get very deep sleep. And palpitations, heart palpitations that are not related to any heart disease, that's another of the symptom. Okay, so these are all hyperventilation symptoms. Now, the British Medical Journal has recognized that breathing exercises help support recovery. So help support recovery from COVID. Because what happens is really, we are just making, so especially with Buteyko, the Buteyko method helps you restore healthy, natural, functional breathing, the way you should be breathing day to day when you're going about your normal business. You're making it more efficient. Bringing it back to efficient kind of breathing. Remember, when you were sick, breathing went up, and on its way down, it gets stuck. So now you're breathing more than baseline. Okay, so what the breathing method does is just to get your breathing back on track, back to how you should be breathing efficiently, so that you are delivering oxygen well and all your organs are functioning well. And by so doing, you are helping, reduce, if not eliminate, these symptoms that are breathing related. Now, if there are other reasons for these symptoms, meaning non-breathing related reasons, because of what COVID has done to the body, then whatever those are will remain, and then you will know that there are other things to look into. Okay, but at least the picture is easier because you've let go of the clutter. You've let go of the simple things of, just by fixing my breathing, I've either lessened or removed the symptoms that are breathing related. Okay, so breathing support in the sense of relearning how to breathe properly again, how to breathe efficiently again, in order to reduce or eliminate the breathing related symptoms that remain post-COVID, will be very good. Now, I wanted to share two stories with you. One is a personal story. My family and I, my children are part of what used to be the second largest COVID cluster in March of last year. So they went to that school, and my two girls had sore throats for just a couple of days, and then they were fine. And maybe a week after, my husband and my son were weak, had muscle ache, and my husband had difficulty breathing. And then I followed suit, but I had both. So my problem is I have an autoimmune condition. So I guess my immune system is not as robust as theirs. So I had all the symptoms. So they had two different, but at that time they were not recognizing very mild symptoms. So we were not tested initially because our symptoms were very mild, and we rang and they said, no, will not. Until the only time they asked us to test was when finally, through contact tracing, one of my girls is a friend of a positive COVID patient. And so then they wanted us to test. But by then, my children were all well. My husband and children were all well. And I still possibly could have been in the tail end of it, just the long haul COVID symptoms. So I may have not been in active illness anymore. So I was the only one tested. I came up as negative, and it's possible. So they said, maybe we did not catch the time when you had the virus. So they put us under the probable cases. And I feel like, yes, most likely. And then nowadays, now I'm hearing that they're saying that in this lockdown for Auckland, they're now saying that these cases have had just very mild symptoms of muscle aches, tiredness, exactly what my family experienced March of last year. Okay, so I'm telling you this because my husband and I, because we were the only two that had breathing related issues in relation to that episode, we started doing the breathing exercises that we learned in our Buteyko course. And so that's how we managed it. So we were able to manage the breathing, so it wasn't as labored, and we sailed through it because of the breathing exercises. Now, I have to say, because we were mild at that time, our symptoms were mild, so we could still sit up. It was the worst because it wasn't bad enough for you to lie down and sleep the whole day, but then it wasn't also good enough for you to be able to do a lot of things. I could still see clients online, but I would easily get tired. So you know how that kind of illness is. It's a little bit iffy because you're like, I want to do stuff, but I don't have enough energy to do everything that I want to do. I don't like lying down and sleeping as well. But yes, so the breathing exercises. Now, the idea is you want your breathing to be as efficient as can be. When you're breathing well, all your other organ systems are functioning well, including your immune system. So it just helps you weather it. It helps you. It's not, we're not claiming to cure it. No, definitely not. But what we want is to have a robust immune system and give it the best chance it has to combat whatever is assaulting the system, right? Now, the other story, which is a really, really good one, is I have a client who is a long hauler, a post-COVID client. She's from overseas, so not from New Zealand. And I started to work with her a month after she was released from the hospital. So she was diagnosed in September, released in hospital in October, and then came to did an online consult with me in November. And so then she had all these symptoms that I listed of long haul COVID: the fatigue, the joint pain, the palpitation, shortness of breath, everything. And she was just in bed, can hardly move, can hardly talk, because even talking made her short of breath. After working for 2 months, we're still working together, right? She's not 100% yet, but she's like 80-90% there. But after 2 months, she was able to walk, manage walking, manage talking. She looked brighter. She was able to talk quite comfortably. And the more important thing is her oxygen levels. So they monitored her O2 levels, and her oxygen levels used to be unstable even at rest. Then it progressed to being stable at rest, but then would drastically drop when she started moving. Then it progressed to, even in movement, it would be stable, it would be steady. So she reached that point, and the point where her doctor even approved that she be off her supplementary oxygen. So she had supplementary oxygen at night because her O2 levels would drop at night. But she reached the point when she didn't need the supplemental oxygen anymore. So she had it even at home, the supplemental oxygen. And so she's quite stable and still working on it. Still working on it in order to get to 100%. But we are very happy with her progress, because what we've done is we've eliminated all the symptoms that were breathing related by helping her restore good breathing patterns, good breathing habits, just by restoring that. So all the symptoms that were related to that went away. And of course, under the guidance of her doctor, she was, still being monitored and being helped by her GP. So this, it is quite inspiring. It's quite, you realize there are things that you can do. You can't just sit and suffer when there are things that you can do. It's empowering. I think that's it. So she's now more confident as well in helping herself regain her health and do things for herself, for her recovery. So I just wanted to tell you about this, because I've been hearing about it, and tonight in New Zealand there's going to be a show talking about long haul COVID patients as well. And I'm thinking, we can help them. They don't have to be in that state. They need to help themselves relearn how to breathe better, to get that bit away, and then just concentrate on whatever other symptoms remain after you get most of that away. Imagine that list that I've just read to you earlier. That long list, if you're able to take that out, because all of that is hyperventilation related, imagine how much better they would feel, and then they can concentrate on whatever else is there that the doctors can help them with. So I hope that has helped you, and yes, there is something that we can do. It is not all doom and gloom. I'd like to empower people to say, I can help myself. And part of you being able to help yourself is you knowing, who do I need? Whose help do I need? And so in that case, have a look at breathing retraining. That is something that will definitely help in the recovery of long haul COVID symptoms. Okay, I hope that's helped. Thank you for joining me. I'll see you next time. Bye for now.